Okay, today we're speaking with Amy Landrum. Amy is an advanced practice registered nurse with certification in wound, ostomy, and incontinence nursing. She is a frontline provider and a compassionate caregiver who brings invaluable skill, knowledge, and expertise to patient care. Amy, thank you for speaking with us today.
Thank you for having me.
So this is something you have shared in previous blog posts and articles. We'll link all of those, but as an introduction to our video viewers, what for you is particularly unique about working with patients who have incontinence needs?
It's a great question. One thing that I think is kind of puts things into perspective is that having urinary incontinence or incontinence needs is not particularly rare or unusual. It's estimated that over 25 million Americans have some form of urinary incontinence or bladder dysfunction. So I think a lot of times it's, there's a level of stigma around it where we don't talk about it and maybe we don't address it, but it's not an uncommon condition. And so the aspect that I find rewarding is helping folks feel like they can go back to living their lives and going to work and having doing all the things they did before and
Mhm.
having the right equipment and the right care plan in place to manage the urinary incontinence.
When someone first learns that they'll need to incorporate catheters into their treatment, their lifestyle, um, what reactions or feelings might come up for them, and how do you support them?
Yeah, I think common reactions can be kind of a surprise and just a fear of the unknown. Um, the idea of a catheter can be off-putting to people. We don't think about inserting a tube into our urethra to drain our bladder, and it
Mhm.
can seem daunting. It can seem scary. People are worried that it's going to hurt. People aren't even sure how it's going to work and how they're going to do it. It just can seem like a really big task, and just I think it's natural for people to react to a change on how they've always done things with fear and apprehension. And, because it has to do with incontinence, sometimes there's a level of embarrassment around it. And
Mhm.
I never want that. We all use the bathroom. There's nothing embarrassing about it. It's just some of us have to do it differently. And in terms of the fear of the unknown, I think the best thing is just to maybe talk to folks who've been doing it and see how they feel about it, and talk to folks who have experienced the same diagnosis that you have, whether it's bladder cancer or just urinary incontinence, neurogenic bladder, whatever the root cause is. You'll find that there's a lot of other folks have been doing it longer, and they can give you a lot of good information so it won't seem so foreign. People are doing it and they're doing okay with it, and so can you. And so that's a good place to start with peer support. um and then also, I think another aspect of it is just getting really familiar with the process and the equipment. Just really getting some hands-on opportunities to touch a catheter, to look at a catheter, to get familiar with anatomy, to come up with like strategies, like how am I going to do this in my bathroom? How am I going to do this at work? Just kind of run through scenarios so it's not all a big surprise. You kind of have a game plan in place. And I think that can go a long way in terms of kind of easing the apprehension and making it part of the routine.
How can they find peer support?
Yeah, there's some great peer support available. It just depends, if you're looking for online support. There's some great online organizations that have forums and have like videos from other folks that are experiencing the same thing. Um, and I can link those maybe at the bottom of this for people to
Mhm.
look into.
Great. Yeah.
Also locally, sometimes you will find, usually through the clinics or the hospitals, you can look and see if there is a support group specific to your condition, whether it's spinal cord injury or bladder or prostate cancer, whatever it is. A lot of times, there is a support group that meets in person with local folks.
So when someone's new to catheter use, what should they expect when they first receive their catheters in terms of training, information, instruction, et cetera?
Yeah, so in an ideal world, we want people to get plenty of opportunities to learn how to use these products before they're just on their own with a package of catheters, right? Um, there's
Mhm.
a lot of specialties that can help with this. It just kind of depends on where the catheter use starts. So, for example, if you have a condition that requires you to use catheters, and it's your urologist who has made this determination, um, a lot of times, offices will have a nurse or maybe even the doctor, or a nurse practitioner, a PA, somebody in that office, will have the time to go over the how to use the products with you,
Mhm.
help you use the products in the office, answer your questions, and do some hands-on training. And if you are struggling and you feel like you've gone home with these catheters and you just don't really feel comfortable yet, you could call the office and ask for more training. That's one area that they can help with. If you're in a rehab or in the hospital setting, or another any other inpatient setting, and they've determined that you're going to need catheters there, nurses may help you with it. Physical or occupational therapists, in particular, may work with you, especially if there's other things going on that might make catheter insertion a little tricky. Like maybe you have some hand dexterity issues and you might need to use special equipment to insert the catheter, or you might need to transfer in and out of a wheelchair. This is where therapists like occupational therapy and physical therapy can really, really help with the process, because they can work with you and your unique situation to figure out how you can independently catheterize yourself. And again, sometimes in facilities, this is just kind of an automatic. Oh, this guy's going to, or this lady's going to
Mhm.
catheterize themselves. We're definitely going to get these specialties on board to work with them. But if that doesn't happen, you can always ask for it. Hey, I think I need some one-on-one training. I need someone to work with me so I can do this independently at home. This is what my bathroom and my living room situation looks like. And home health is another option too. So when folks go home and they're getting maybe nursing care or therapies in the home, it's another good time to bring up, hey, I'm new to catheters and I want some of these visits to be about helping me learn how to catheterize independently, helping me figure out my unique living situation and how I'm going to do it. And so that's another spot for training. Lastly, your DME companies and your manufacturers may have some educational resources as well. They may have clinical folks on staff like myself who can provide support over the phone and who can put you in contact with other resources online and things like that.
Great. So, with that, today we're specifically addressing the reasons someone might need to talk about using a different catheter type with their provider. So let's talk about some of the problems that patients experience with catheter use and what their options are in each of these scenarios. To start, someone might have trouble with insertion. What are some of the reasons this might occur, and what alternatives can they discuss with their doctor?
Yeah, so struggling to get the catheter in, it can be frightening. You were told that you have to do this and you're just having trouble getting it in. And so some of this depends on anatomy. For biological females, it can be more difficult to see and find the urethra if you haven't done it a lot, as opposed to males who it's just a little bit more visible. So if it's an issue where you're just struggling to find where to put the catheter in, especially if you're a biological female, um, there's some mirrors and some things like that are specifically designed for this purpose. It's a
Mhm.
mirror that straps to your leg or sits on top of the toilet seat, or if you're laying down to do it, kind of sits between your legs. Some of these mirrors are lighted. It just gives you a better view of the situation, so it's easier to put in. So I guess the most important thing is figuring out, why is it difficult to get it? Do you just need a better visualization of where you're trying to put it and maybe some more support and training? Or is it, wow, you know where to put it and you're like having an actual blockage or difficulty putting it in? That's more
Mhm.
of a medical concern. Um, if you're having some kind of blockage or issue inserting it, this is definitely something to bring up with your healthcare provider, because there might be something going on. There might be something with your anatomy or something has changed, and trying to force it in is going to cause damage. So this is something you want to immediately bring up to your healthcare provider. A really common one that we see is that men have a prostate, and the prostate is sometimes it can be kind of enlarged or swollen in a way that makes putting a straight tip catheter in kind of difficult, where you feel like you can't get it in, or if it's painful. And there's actually a special type of catheter called a coude tip catheter that is designed for that situation. But again, this is something you definitely want to talk to with your doctor or your healthcare provider about to determine, hey, are we having trouble getting this in because it is an enlarged prostate? Or is there something off about the technique? Or even, the catheter size. Are we using the right size here? So yeah, it's important to loop in your healthcare provider, but typically speaking, usually there's a technique or a product change that can help with insertion if insertion is really difficult.
What does it mean to experience an insertion trauma, and how can that be avoided?
Yeah, so insertion trauma is something we want to avoid. This is when we think there might be some damage occurring from putting the catheter in. So,
Mm-hmm.
there might be bleeding, there might be pain. Those are usually the two signs. Like if it's really painful, and that's a big question that comes up is like the first thing that people think is like, wow, catheterization is going to be really painful. It typically is not, that's not normal for it to be really painful. The way that the catheters are designed and the things that we do to make them slippery are supposed to kind of negate a painful insertion. So if it's really painful or there's bleeding, this is what we would call trauma with insertion. And we
Mm-hmm.
don't want to do that. We don't want to do a lot of trauma to the urethra. Um, One of the big things with avoiding urethral trauma is making sure you're using the correct size of catheter, and this is something that your healthcare provider is going to determine for you. It's usually it's required on the order when they order you these products that they put what size it's supposed to be, and that by
Mm-hmm.
size I don't mean length, I mean diameter, because
Right.
everybody urethra is a little different. The other thing to avoid traumatic insertion is that we want to make sure that you're using a catheter that is either well lubricated or has a hydrophilic coating.
Mm-hmm.
Lubricant is something that you add to the catheter and then you insert it. Hydrophilic catheters actually have a special coating that is part of the catheter that is very, very slippery and stays slippery on the way in and the way out and doesn't wipe off. And
Mm-hmm.
these things are really important. So having a catheter that is dry will cause trauma. So we really want to avoid that. The other thing is just to make sure that we're inserting the catheter correctly. If it's a coude tip catheter, for example, the kind we talked about for men that have trouble passing the prostate, there's usually, instructions that say like, this is supposed to be inserted with the coude tip facing up. We would want to insert that correctly. Or we would want to make sure also that you're in a good position, you're able to see where you're putting it, you're able to kind of relax your muscles and just kind of let it go in. So these are all things that we can do to help reduce trauma.
You mentioned, you've already kind of mentioned some of these things, but let's say someone experiences pain using catheters. What are the potential causes for this pain?
Yeah, so if someone's experiencing pain with insertion, um, there are a couple of causes. We would think that maybe potentially is the catheter dry? Has it been
Mhm.
lubricated properly? Does it have a hydrophilic coating? Some catheters require you to activate that hydrophilic coating by popping a packet of water inside the catheter and shaking it up. And if you didn't know that and you inserted it without doing that part, the catheter would be really dry. So we just want to make sure that you understand how to lubricate and or activate the hydrophilic coating if it needs activation. Some are ready to go and don't need it, but just want to make sure you know your product and that it's slippery going in, basically. Um,
Right.
Another thing would be to make sure that the catheter is the right size for you. If it has a coude tip, you're inserting it correctly. Um, these are all things just kind of like I just mentioned. The other thing too to think about is if you're doing everything right. Like, yeah, the catheter is slippery. I'm inserting it the way I've always inserted it. And now I'm experiencing pain. This could be a sign of something else going on. This
Mhm.
could be an infection. This could be a change to your anatomy. This could be something else going on. So don't ignore it. This is something you want to call your provider and get checked out to see, okay, what's going on? Something's different. This is painful and it's not supposed to be.
Right. Speaking of infection, what about the signs of infection? What should patients look for? And obviously, treating the infection itself is paramount, but how might they mitigate future infection vulnerability?
Yeah. So one thing that I like to talk about, with patients is just, um, unfortunately, the reality is if you're somebody who uses catheters, you probably have an underlying risk factor that predisposes you to urinary tract infection, because your bladder may not be functioning as it
Mhm.
did before. And so that's kind of just an underlying risk factor that makes infection more likely. The other thing that makes infection higher, in people who use catheters is, even if it's super sterile technique, you're inserting an object into your urethra sometimes multiple times a day. So these are just risk factors for infection. I think sometimes patients, I mean, we want to use clean technique. We want to avoid contaminating the catheter. We want to insert it in a certain way that reduces the risk of getting bacteria on the catheter and introducing them to the bladder. However, sometimes patients get really wrapped up in thinking that they're doing something wrong, and that's why they may get a UTI. And that's not always the case. It's just you're more likely to get them because of these risk factors. But that being said, it's good to know what the signs are. The signs of UTI in catheter users are a little bit different than people who don't use catheters.
Mhm.
So, um, sometimes if you take a urine sample and there's some bacteria in it, your doctor may say, oh, you have a UTI. That's not always true with catheter users. The majority of long-term catheter users, they have some bacteria in their bladder and in their urine all the time. Just because the bladder isn't flushing itself out normally, it's having to be drained, and you're putting an object into it multiple times a day. So it's called asymptomatic bacteriuria, and it's pretty common in folks who use catheters, but it doesn't necessarily indicate that you have an actual infection. You just have some bacteria in your urine. So the signs that we use to diagnose catheter users with infections are a little bit different. Bacteria, just a little bit of bacteria in the urine isn't enough. We need other signs of infection. And so we're really looking for systemic signs. So for example, if you are having pain, if you're feeling pain in the bladder, in the urethra, when you're catheterizing, this could be a sign of the inflammation caused by the infection. If you're having any systemic signs of infection, fever, chills, just feeling sick, these are signs of systemic infection. If you're having signs of kidney infection, like flank pain, back pain, and like chills and higher fever, these are signs of kidney infection. Another sign of infection too is if, sometimes if you have these physical signs paired with a sign of having bacteria in your urine. So for example, if you're having, fever, chills, and you have cloudy urine that has a strong odor that they test and has bacteria, then you have a UTI. So it was just, we're kind of looking for more physical symptoms along with your classic, oh, there's some bacteria in the urine symptoms too, just because we don't want to treat people with antibiotics inappropriately. We want to make sure you actually have a UTI versus just having a few bacteria swimming in your urine.
Yeah. Are there certain catheter types that address someone who's particularly prone to infection?
Yeah. Um, there are some products that have less risk of contamination,
Mhm.
with the catheter. And so what those products look like is they may have what's called like a protective sleeve over the catheter. So kind of like a plastic sleeve. So when you're
Mhm.
handling the catheter, even though we want you to wash your hands and have a clean work area when you catheterize yourself, this protective sleeve keeps your fingers from touching the catheter at all. Some of them will have features like a little gripper. It's like this little like plastic thing that can slide up and down the catheter that gives you something to hold onto, again, without actually having to touch the catheter, because we want to keep the catheter as free from contamination as possible. There's also a type of catheter called a closed system, which has all of these features. It usually is a touchless insertion process, where you never touch the catheter, as well as a closed system. So the funnel end of the catheter isn't actually exposed to the environment. It's
Mhm.
connected to a bag, allowing the urine to flow directly into the system. So the catheter itself is never exposed really to the outside environment. It's this closed system. And so, yeah, these features can definitely reduce the risk of contamination of the catheter.
Are there differences in, and you've mentioned this a bit with people who have a prostate, but are there differences in equipment based on the patient's biological sex?
Yeah, and there definitely is. So coude tip catheters are typically they just kind of have a different tip that's better for going around the prostate.
Mhm,
And those are a great option for men that are experiencing difficulty inserting the catheter due to the prostate. There's also lengthwise. So the male urethra, if you're just thinking about anatomy, is a lot longer than the female urethra. The female urethra is pretty short. And so just for convenience sake, there's a
mhm,
whole like every catheter manufacturer out there makes female length versions of their catheters just so you don't have to deal with all this extra catheter if you don't want to. They're
mhm,
much shorter. They might fit easier in your pocket or in your purse. You don't have to worry about it being kind of long when you're trying to insert it. But on the flip side, some women find male length catheters, which are the longer ones, easier to insert. They like having that extra length, and there's nothing wrong with that. You can definitely use that too. So there are female length catheters and male length catheters. One is about 14 to 16 inches long. One is usually about 2 to 4 inches long. And then there's some that are kind of in between. Like there's some 5 inch catheters and 8 inch catheters too. And so it's just really patient preference. It's what's easier for you to work with. What do you
mhm.
prefer? What do you like better? There's not like a hard and fast rule with those. You have to use this or you have to use that.
Great. Some people want their catheter use to remain discreet and private in certain circumstances. Are there particular versions they should ask about?
Yeah. So, and this is like a big one that comes up a lot with folks that travel and go to work and they're doing things and they're living their life. And the thing is about, especially with male length catheters, they're about this long. They're pretty long. And so if you need to go on a trip and you need to take, 50 of those with you, it's like a lot. It's a lot of catheters and they take up a lot of space. Or if you just want to go out for a night, like, you're going out on the town with your friends and you're like, I don't want to carry this 16-inch situation with me when I have to cath. They have a lot of what they call like pocket versions
Mhm,
um, of catheters. And so what it is it's a catheter that is it's packaged and folded in a way where it's in much more discreet small packaging. And
mhm.
so instead of being this long package that you have to like figure out, because you don't want to like bend it up and you want to kind of keep it intact so it doesn't mess up the catheter. These are actually designed to be much smaller and folded up. So you could put them in your bag or your pocket or anywhere. So not every brand, not every make and model has a pocket version, but there are a lot of different pocket versions available. And some people will do both. Some people like, I use the full length at home and I use these pocket versions when I'm traveling. And that's totally doable with most people's insurance. So you can kind of mix and match different styles of catheters to sort of better meet your lifestyle needs. Um, yeah, so there's another thing that I want to bring up too that's important to think about too with packaging is that can be a real deal breaker in terms of hand dexterity stuff. So if you have maybe a higher level spinal cord injury or you have arthritis or something like that, the catheter itself the catheter is always important, but the packaging may be just as important because you need something that you can reliably open anywhere. And so it's okay to be like, well, I really like this catheter, but oh my gosh, it's so hard for me to open this thing. What else is out there? That's a good thing to explore. There's lots of different types of packaging, some which is really clever and has really taken into consideration that maybe not everybody has great use of their fingers. Maybe they need to open it with their thumb.
Right.
That's an option. So it's just whatever issue you're having, odds are that somebody has come up with a catheter that might work better for that situation.
Well, this has been incredibly valuable information. To close, what should someone do if their provider doesn't have the extensive experience with the potential nuances of catheter types as you do? What other resources and support are there to help them?
Yeah, that's a great question. And unfortunately, it's pretty common. Like sometimes you go to doctor's offices and things like that. They're really excellent at diagnosing, your situation and figuring out what you need to do about it and treating and that kind of thing. But in terms of all the different products out there, that's not necessarily in their wheelhouse. Um,
Mhm,
a good bet would, again, like some of your occupational therapists and your urology nurses, they may be a good resource to figure out different types of catheters and really work with you in terms of getting a routine and a product that's going to fit your lifestyle. But if you're feeling like in your local community, you haven't been able to find these resources, you know, there's not a great support group, you haven't been able to really tap into anybody who makes you feel like they have the time and the resources to let you try a bunch of different products, that's where your manufacturers and your DME companies can really help you out. Because these companies, like for example, ABC Medical, we have access to all these different brands of catheters. We can send you samples of different things to try. We can walk you through how to use those samples. And then if you have questions, we can be a resource because it's our job to know the products. And so DME companies are a great resource for that.
All right. Well, it was a pleasure to speak with you today, and we will share your resource links mentioned as well as any others that you have and want to share. And thank you so much.
Sure. Thank you.